Hey guys, what's up? Okay, let's start this topic for today, which is metabolic response to injury. So, before that, I'm gonna give a basic introduction about what an injury is. So, you fall down, that is injury, or that's kind of a mild injury. You undergo a road traffic accident, that is a very severe injury. One person undergoing a surgery, that is a very major injury. So, having known what the injury means, we'll go into various aspects of the injury. Like, we'll see the basic concepts of homeostasis, we'll also see the mediators of the metabolic response to injury, inflammatory mediators, response, catabolic elements, avoidable factors, the body composition, and insulin resistance, and so on. So let's get started. So, metabolic response to injury. So there are a few basic concepts in homeostasis. First of all, what is homeostasis? Homeostasis means that the maintenance of internal environment. That is what homeostasis is. Maintenance of constancy is homeostasis. Claude Bernard said that milieu interieur was important. Milieu interieur is the name given by him to the internal environment. Walter Cannon said that homeostasis is the process which maintains the steady state. John Hunter suggested that injuries response is to heal the host, which means following an injury, the person is going to heal. That is what the injury is for. Then there is this open loop, which is suggested by anonymous person. So he says that a signal detector processor effector pathway is continuously working in order to ensure homeostasis is restored. Let's see the graded nature of it. So about the graded nature, uh, so whenever it is dependent upon the severity of the injury. So whenever the injury is very severe, then the response is severe as well. So what kind of changes will happen during this maintenance of homeostasis process? There are two kind of changes which happens. One is the physiological change. The second one is the immunological change. As you can see here. So first, in the physiological change, it is also called the metabolic change. Just guys, it's all the things which come under the vital signs like the temperature, the heart rate, the respiratory rate are all increased, including the BMR, the basal metabolic rate also will increase. We're talking about the immunological one, the WBC count will raise. Major trauma or sepsis will lead to MODS, SIRS, and increased breakdown. MODS stands for multi-organ dysfunction syndrome, and SIRS is severe systemic inflammatory response syndrome. There are a few variability factors which takes a note on who gets it more and who gets it less. I mean, the response of injury is going to be different for different people. One person has a higher hit of response and the other has a lower hit of response to it. And now I'm going to say about the immunologic and whatever response, guys. So this response is that this smiley face here, that is the normal homeostasis, that is you normally, and the lightning figure over here, it says that you're getting yelled at, and again you get angry, which is suggested by this fire. Okay, I couldn't draw fire any better. So you start yelling at them back, and after that you feel bad. Okay, what have I done? So you feel bad, and after that you apologize and everything is over. So that's what happens normally, guys. Normal environmental human beings environment, whatever happens. And similarly, initially the person is fine, that is, the person is in a homeostasis state, and after that there is a trigger, that is the injury, that chapter topic. And after that, pro-inflammatory cytokines are released, which is basically the anger analogy. And after that you feel bad and you say sorry, so that is anti-inflammatory cells, and then homeostasis is restored. So pro-inflammatory cells, guys, those are the monocytes, the macrophages, neutrophils, and the dendritic cells, not very special. And anti-inflammatory, they call it CARs because you buy a car and in order to apologize to a person. Okay, I'm just kidding. CARs is actually an acronym for counter-regulated anti-inflammatory response syndrome. So as a result of that, immunity is reduced and the resistance to infection is also reduced. And next we talk about the mediators of MRI. MRI is a metabolic response to injury. Catabolic elements will increase the basal metabolic rate. So whatever causes breakdown will cause inflammation, which causes increased BMR. Protein, the skeletal muscle protein and the liver protein, there are two types of proteins. So in the skeletal muscle protein, normal state, when there is no injury, protein is going to become high during feeding state and resting state, and it's going to be reduced in exercise. During exercise, after exercise, when you're resting, then only protein will form. So catabol is similar, protein loss will happen. It occurs in the skeletal muscle, respiratory muscle, and the gut muscle. Skeletal muscle, you know what happens, atrophy, so muscle wasting happens. In the respiratory muscles, ventilation, hypoventilation will happen, and in the gut, motility will reduce, which is why constipation is very common. Mechanism of action of this protein catabolism, otherwise called proteolysis, is due to this ATP dependent ubiquitin proteasome pathway. Other insignificant things or slightly significant things are lysosomal cathepsin pathway, calcium calpain pathway as well. So the clinical feature for all these things which we can see is QTFM, that's a mnemonic for it. So Q is the quality of life is reduced, and thin is the person becomes asthenic. F is for fatigue, there is a lot of tiredness, and M is for morbidity, mortality, which is significantly raised. And then there's this interleukin 6, which is the main inflammatory mediator responsible for production of APP or the acute phase proteins. Acute phase proteins could be positive and negative based on whether it increases or decreases following an injury response. So, as such, CRP, that is the CRP is going to become high, which is why it is called the positive one. CRP and fibrinogen are going to be high, and fibrinogen is responsible for repair as well. That makes more sense. And albumin is going to become reduced. And insulin resistance. So about the insulin resistance, at least for 2 weeks insulin resistance will be there, which is why IV insulin infusion is very essential. But however, in ICU patients it will cause hypoglycemia, which we don't want, because it causes hypoglycemic coma. And to overcome this difficulty, we use strict glycemic control. So whatever food they are getting in, taking in, is what matters there. Body composition. The body composition, in an average 70 kg person, 12 kg is protein, 13 kg is fat, 14 kg is extracellular water, 28 kg is intracellular water, 3 kg is minerals. So if 1 gram of nitrogen is lost, it means 36 gram of lean mass is lost. Lean mass means nothing but the total mass of the body excluding the fat. For example, if in a 70 kg person, 57 is the lean body mass excluding the 13. 70 minus 13 is 57. And during starvation, if the person loses 30 to 40% of the protein, he will survive, but more than that he won't survive. So the maximum duration of survival during starvation is 50 to 60 days. And the person should be very adequately having a lot of protein, then only 50 to 60 days. Resuscitation, the good measures are giving epidural analgesia and oral feeding ASAP. And then IV saline infusion is not very good. Crystalloids are good though. Avoidable factors are, we don't want volume loss, which is why crystalloids are given. Temperature hypothermia is not required, which is why forced air heating cover is given. Edema is not needed, which is why resuscitation and crystalloids are given. I've written all the things, the chemicals which are responsible for all these, and or are synthesized in response to all these. And then under perfusion can also occur, and systemic inflammation can also occur. That is due to INOS, and which synthesizes nitric oxide. Starvation, due to starvation, initially the brain will need glucose, which is why the glycogen is converted to glucose, and after 24 hours gluconeogenesis takes place. Other tissues will metabolize fat because of low insulin. Fat is going to convert into ketone bodies, that is going to be taken up by the brain. Usually we don't want any protein to be wasted, which is why adequate amount of glucose given is very important. So IV 4% dextrose and IV 0.18% NaCl is very important, which is protein sparing. It equals 80 gram of glucose. Immobilization will cause muscle wasting, which is why surgery mudaja we have to mobilize the patient. And then surgery should be minimal access surgery. Minimal starvation should be there. Early mobilization is there, and less pricking pain means less needles. Thank you.